This video provides instructions for the 3M Bair Hugger warming gowns and is intended for clinicians only. The 3M Bair Hugger temperature management system is intended to prevent and treat hypothermia. In addition, the temperature management system can be used to provide patient thermal comfort when conditions exist that may cause patients to feel too warm or too cold. The 3M Bair Hugger warming gown can also be used anytime a patient gown is needed. Prior to use, consult detailed product indications, limitations, safety information, and instructions in the provided instructions for use, operator's manual, and preventative maintenance manual. Upon admission, the patient receives a single-use 3M Bair Hugger warming gown. Instruct your patient to put on the gown so the opening is in the back. The gown should be loosely tied at the side and neck to allow the air to circulate. To begin pre-warming therapy, connect the 3M Bair Hugger warming unit hose to the appropriately sized hose port. To ease insertion, first break the film with your finger. The goal of pre-induction warming is to transfer enough energy to help prevent post-induction hypothermia without causing significant thermal discomfort or sweating. All adult patients scheduled for any type of anesthesia of duration greater than 30 minutes should be considered candidates for pre-warming. Turn the knob on the handheld temperature controller counterclockwise until it clicks to discontinue warming therapy. Then disconnect the hose from the gown. To minimize gaps in warming, disconnect immediately prior to transport. Patients wearing 3M Bair Hugger gowns arrive in the OR with all the warming tools the surgical team needs for multiple positions and orientations. For easier gown positioning, untie the side and neck ties and open the gown in the back prior to placing the patient on the OR table. Extend the gown to its full length for optimal heat transfer. Make sure the safety belt is not over the portion of the gown that will be inflated or rolled up. The patient's position will dictate the position of the warming gown. There are plenty of options. The gowns can be used for upper body prone, upper body lateral, upper body supine, lower body prone, lower body lateral, and lower body supine. For torso or lower body warming with the 3M Bair Hugger Flex warming gown, unfasten the fastener strips of the 3M Bair Hugger gown sleeves, fold over the upper body insert, and slide the entire gown down on the patient. Remove the backing from the patient adhesive strip located on the upper body insert and adhere to the patient. Rolling, gathering, bunching, or compressing the inflated air channel insert of the gown can occlude airflow and reduce warming of the patient. For upper body warming with any gown, the gown can be rolled or accordion folded onto the top of the upper body area. The Flex Gown upper body insert can be deployed, secured with the adhesive strip, and secured to the arm boards via the perforated tie strips. Remember, at least one arm of the upper body insert must be deployed if you choose to use the upper hose port. There is also a head drape that can be deployed in intubated patients. The drape is easily identified by a blue dot found between the gown neckline and the upper body insert. Prior to transferring the patient to the PACU, disconnect the hose from the gown and perforate the upper body extended inserts and head drape, and remove the patient adhesive strip. Re-don the warming gown on the patient for use in the recovery room. As with any warming therapy, always monitor the temperature and cutaneous response of patients who are incapable of reacting, communicating, and/or who are without a sense of feeling every 10 to 20 minutes or per institutional protocol. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have any product questions, please contact your local 3M representative. 3M offers device training upon request.